Hello, I'm David Bohnert, Ruminant Nutritionist and Extension Beef Cattle Specialist with Oregon State University and the Eastern Oregon Agricultural Research Center, and I'm here to present an Eastern Oregon Ag Minute. This week I will be discussing preparation for the calving season. In terms of cow profitability, a dead calf is worse than no calf at all. This is because you can cull an open cow, but losing a calf at calving represents a full season of lost effort and investment. The first priority for cow-calf producers should be to make sure that the cow herd is in good condition to care for the calf and to rebreed in the spring. A good nutrition program is essential during the final weeks of pregnancy and the early weeks of lactation. This is because a cow's nutritional requirements are the greatest at this time in her life cycle. Research has shown that proper nutrition during this period of time will improve calf immune function and ability to withstand cold temperature at calving. Consequently, survival rate of newborn calves is increased approximately 20% in cow herds fed to meet their nutritional requirements. Calving season is the most labor-intensive time for cow-calf producers, often involving long days and sleepless nights. University studies and observations by ranchers have shown that the time of feeding can influence what time of day calves are born. In 3 studies carried out at Manitoba, Canada, Iowa State University, and the Livestock and Range Research Station in Miles City, Montana, approximately 2,800 cows were fed either in the morning or late afternoon. In these studies, approximately 80% of the cows fed in the late afternoon had calves during daylight hours, compared with 50% of the cows fed in the morning. The advantages of calving during daylight include it is easier to observe the herd and assist with calving, decreased risk of hypothermia in newborn calves, and fewer calves lost. Feeding in the late afternoon will not eliminate nighttime calving, but it can increase the number of calves born during daylight hours. Having the proper equipment and supplies available at calving time can mean the difference between a dead or a live and healthy calf. Your equipment should include 30 and 60-inch OB chains, OB handles, calf jack, scalpel, half-inch tube with funnel or pump, plastic sleeves, appropriate lubricant, umbilical tape and sewing needles, and some form of disinfectant. In addition, it may be prudent to talk to your veterinarian in an attempt to have the following pharmaceuticals on hand: oxytocin, Dopram, and Rompin. Having the proper equipment and supplies available for the calving season, but not knowing how to properly use them, can result in injury and or death to the calf and potentially the cow. Therefore, consult your local veterinarian or beef extension specialist if you have any questions regarding their use. When a calf is born, it is virtually unprotected against infectious diseases until it absorbs an adequate supply of colostrum with its associated immunoglobulins. For maximum protection, a 75-pound calf should get 2 to 3 quarts within 4 to 6 hours of birth. However, if a cow does not have any milk, what do? The best alternative is to obtain colostrum from another cow, which can be stored frozen in quart containers until needed. Care must be taken when thawing frozen colostrum. Research has shown that rapid defrosting, using boiling temperatures or microwaving, destroys many of the immunoglobulins necessary for immunity transfer. The recommended method of thawing colostrum is to warm water thaw. This involves immersing a 1 or 2 quart container of frozen colostrum in 110-degree water and stirring every 5 minutes until the colostrum reaches 104 degrees. This normally takes about 40 minutes. If a natural source of colostrum is not available, there are various colostrum substitutes that can be purchased. However, these products are not as effective as natural colostrum in protecting against infectious diseases. Calving management can have a major impact on the number of calves available for sale in the fall. Some recommendations that have been shown to increase calf survival are to observe the cow herd closely, especially first calf heifers, to have the proper equipment and facilities available and in clean working order, to provide assistance during delivery or to call a veterinarian when needed. Don't wait more than a few hours after labor begins. When pulling a calf, loop the chain or rope above the ankle joint and apply gentle traction on one leg at a time. Remove the mucus from the calf's nose and mouth immediately after birth and make sure it is breathing normally. Disinfect the navel cord with iodine to help prevent infection. and keep birth weight and calving ease records to identify those sires and dams responsible for calving difficulty. The use of proper facilities, equipment, and practical skills can minimize many calving problems. I'm David Bohnert. Thanks for listening.